I was exposed to orthopedic surgery at a young age because I was always injured. And these miracle workers would come in and they would somehow get me back on the playing field. And I wanted to be like them. The type of person I see are patients who are between 30 and 90 years old, and they're losing function of their shoulder or elbow. The simple activities of daily living have become more difficult. They're not sleeping well at night. They wake up in the morning with pain. They have difficulty taking that gallon of milk from the top shelf. They have difficulty getting dressed. What's unique about the Penn shoulder and elbow service is that we all have scientific backgrounds. We see a patient, we are able to identify the problem, and we're able to educate the patient on what the problem is. We think about the problem, and we think about the problem not just with the concept of just let's do surgery. Let's try to understand. Let's try to prevent the problem. Let's try to treat the problem. And if you need surgery, well then we'll then recommend surgery. In collaborations with our research colleagues, we're trying to understand or better understand how we treat patients who have, for example, rotator cuff disease. And it's not only just how to fix it, but we're trying to understand how the rotator cuff tears, how to better fix it. After we fix it, what's the best way to rehab it? And then if we don't fix it, what happens to the joint in that scenario? My practice is filled with individuals who come in with terrible function and terrible pain, who are very unhappy, and their life has focused around the pain in that joint, and we're able to get them back to a very satisfied level and have them regain their normal life. I'm Dr. David Glaser. I'm the section chief of the shoulder and elbow service at Penn Medicine.